a lot of people may be familiar with animatronic pets, right? And you see kind of one right here, our little cat, and then also, our dog. So actually, Joy for All Pets is one who developed the animatronic pets. Now, if for some reason you don't have access to it being animatronic, you can use any kind of lifelike stuffed animal, okay? I use the word lifelike because we want to make sure that these interactions are served with dignity, right? Because our senior folks deserve that. Even though in my model, we talk about the theory of retrogenesis and how people with dementia, they're experiencing the world as, very similarly to how children do. We do not treat people with dementia like children, right? But there are similar techniques we can use with the understanding of where they're at developmentally now, but we will always want to approach them with dignity and respect. And so the animatronic pets are great because they're multisensory, right? They're visual. These particular pets, you can hear them, you can turn them on, they're auditory. It's a tactile stimulation, right? And so it's very multisensory in nature. It can also be olfactory too, as you may see here. I'm big into aromatherapy. And so you can actually put a couple of dabbles of the essential oil like lavender on the lapel of the dog, and then you're going to have that olfactory stimulation. And lavender is very calming for the person with dementia. And so you're kind of approaching them in a multisensory respect where they get that interaction, but also they're staying calm, cool, and collected. And as we know, pets provide that unconditional love, right? And so there's just that connection already that's served based on what pets do for us. Because I know not even now to today, it's hard to get actual certified pet therapists in the facilities still, because some may still be reserved to not bring in that extra, they're being cautious because of COVID, so with that said, they may have not recontacted their pet therapist yet to come back in. So these are a great supplement because you can do this morning, noon, and night, and it's a one-time cost. You're not continuously paying a pet therapist or trying to book them, if you will, if they're for free. So with that said, the animatronic pets are a great way to be multisensory. I mean, I have worked with people with dementia and offered these to them, and they could sit for hours brushing them and talking with them and taking them on walks and all those kinds of things that they love to do with them. I would suggest a training in this just because there are questions that might be thrown your way from the resident that may catch you off guard, and how do I respond to that, right? So a good training would be beneficial with that. But when you are, just some basics, when you're approaching them, you want to show them the pet and look at their facial expressions, their body language. Do they seem to want to interact with the pet? If they don't, maybe A, they don't like pets or that particular pet, or B, they're just not having it right now, or they're just not into it. So you don't want to force it upon them, but it's always important to show them that and then say, hi, can you help me with taking care of my pet? Can you watch her for a while? Things like that. So that way they know to interact with it. And that can go, all too while we see residents kind of congregating around nursing stations and facilities, so that can easily go on a nursing station. It can go on a couch of some sort, or even on the resident's lap, and they can interact with it, which is a lot of fun. So the other thing I want to mention too is very similar to the pets is dolls, right? And so infant doll therapy, I know it's controversial still, which I think is a shame because infant dolls can provide so much interaction. It's very multisensory in nature, just like the pets, where it's visual. Some are auditory in nature, where some dolls that you get them can make noises. We just recommend stay away from ones that cry because nobody likes that. That can be distressful. And so with that said, it can be visual, it can be auditory, but again, it could be olfactory. If you decide to put a couple of essential oils on the baby's clothes, you get that olfactory sense as well. But with the dolls, you want to make sure you have accessories, which is so much fun. Their clothes, diapers, bottles, burp cloths, things like that, because they can interact with the baby, but they can also interact with just the accessories. So oftentimes residents, maybe if they were homemakers growing up, they would love to do the laundry. So maybe they could sort and organize the burp cloths or the clothes or the socks or whatever it might be, which also adds a component of cognitive stimulation. They're using their executive functioning skills in their frontal lobe, where they're organizing and sorting by color or by size or something like that, which is, again, hours and hours of joy that it can bring them. And again, the staff can just be in the background doing their documentation, cleaning, passing meds, whatever they need to do, obviously, to help with that. So this is a wonderful approach as well.